Okay, now we're going to look at the anatomy and physiology behind infusion therapy, and this is just going to be the basics because you all do receive A&P in your LPN course, and you will receive kind of a refresher on A&P as you go through pathophysiology as well. Some of the systems and organs that are involved with infusion therapy, and some of these you might not even think about, integument and connective tissue, of course, this is involved as far as venipuncture itself, neurological system, the cardiovascular system, which is probably the one that we think about the most, and then the respiratory system. So a couple of systems that I want you to review, or not systems necessarily. I want you to review the cardiovascular system, especially the heart and then the veins and arteries. So these are a couple of YouTube videos that just kind of give you a refresher on how the heart functions and how the arteries and the veins differ and how they play a part with the heart itself. So if you'll remember, arteries are a lot deeper than veins. You do have some that are a little bit more superficial, but typically arteries are deep. One of the things that we really have to consider, and I have a story about this, when I was first out of nursing school, they teach us how to do venipuncture and how to choose the correct vein. But I was actually admitting a patient to the intensive care step-down unit, and the patient had come in through a direct admission. And, of course, with the direct admit, they don't come to the emergency room, therefore they don't have an IV already inserted. So I was in the room and I was getting my IV stuff together, and as a new nurse, this fear just rushed over me as if I had never done this before, which I had. And I thought to myself, what if I hit an artery? So I had a nice little panic attack. Of course, I was, like I said, a brand new nurse, and I was freaking out for no reason. But, we don't want to inadvertently puncture an artery. Because if you remember, arteries have very high pressure compared to the venous system. So you puncture an artery, it's that typical, scene on ER where they're bleeding out from an artery and blood's spurting everywhere. It's not necessarily like that all the time, but, when you do puncture an artery inadvertently, you do run the risk of causing some vascular compromise to whatever part is distal to that artery. Of course, bleeding tendency. And you can also develop compartment syndrome, which is basically where the pressure within the periphery, whether it be a leg or an arm, gets so great that you get insufficient blood supply to that tissue, and basically you compromise that extremity. So you can actually run the risk of losing an arm or a leg due to compartment syndrome. And I don't know if you've ever seen this or been exposed to this in the clinical area, and they don't do them that often, but in those instances, they do have to do a fasciotomy because they have to relieve that pressure. Otherwise, the pressure is going to be so great on the arteries and veins within that extremity that they, lose risk or have an increased risk for losing that extremity. So, in comparison, veins are more superficial, but you can have deep veins. I guess everyone's probably heard of a deep vein thrombosis. Those are typically found in the lower extremities. So you do have some veins that are a lot deeper, and with a deep vein thrombosis, we know that that's a blood clot in those deep veins that can put that extremity at risk. But veins are the anatomical part that we typically do use for venipuncture. And sometimes you can have veins that have varicosities, and those are the veins that we actually want to avoid. We don't want to venipuncture in a gnarly vein that is not very straight, because typically you'll either damage the vein when you venipuncture and go through both sides, and then of course you have a blown vein, which means that it can't be used for infusion. Or you might get the IV catheter inserted, but you have issues with infusion through that because either it's up against the wall because the vein is twisting and turning, or you're up against a valve because there's a lot of backflow issues in those varicosities. So they're just not ideal for venipuncture. So when we think about choosing a site for venipuncture, this is just a graph that kind of helps you to identify some of the sites that we can use. One of the things that I like to tell students when we're actually going to venipuncture a patient If you're venipuncturing to leave an IV catheter in place for continual IV infusion, you want to find a place, number one, that has a good vein, meaning that it's large enough, it's straight, and that you can, palpate easily, because you can't always go by sight. And then also, you want to choose a place to where the IV catheter can be secured. One of the issues with indwelling IV catheters that stay, in the patient for infusion therapy is if you don't get it in a location that it can be stabilized, it tends to give you a lot of problems as the nurse. And of course, it gives the patient problems as well. A good example is if you use the antecubital fossa as your location. Every time that patient bends their arm or gets up and goes to the bathroom, you're either going to have to stop the infusion because it's going to alarm. You're going to run the risk of damaging the internal catheter, and it's not going to want to infuse properly. So there's just a lot of issues when you get into an area anatomically that you can't secure and can't stabilize that catheter. So I like to use the forearm myself. The forearm tends to be less painful than using the veins of the hands, but I have used the veins of the hand, in the instance where they just didn't have anything in the forearm that we could use. So, and you can stabilize on the hand, but again, the hand and the fingers move a lot, so sometimes it's a little bit harder to stabilize there than it is on the forearm. So this is just a chart that describes the veins, their locations, and the advantages and disadvantages. And again, if you'll look at the antecubital, of course, it's a large vein. It's good for in and out venipunctures, like if you're drawing blood work or something like that. But again, it can be very difficult to infuse through because that continued movement right there at that joint tends to inhibit flow, and then of course you're battling the infusion pump, and the patient's irritated too because they're still trying to use their arms, and every time they bend their arms, that catheter is upsetting them or aggravating them. So important considerations when we're going to place an IV. Number one, we need to know how long it will be in use. Short catheters that are inserted into the periphery are typically used for short-term infusions. If you're going to be infusing, let's say, for instance, you have a patient with osteomyelitis and they're going to be receiving weeks of infusion therapy, a short catheter is not going to be ideal for that patient. You're going to need to really choose an IV that's more of a long-term catheter, such as a PICC line. Again, we want to look at can the cannula of the IV be stabilized. Again, if this is not an in and out venipuncture for lab draws, you're going to have to be able to stabilize that catheter so that you can maintain it. Will the insertion site chosen be more painful than another? Again, I mentioned the antecubital fossa, the upper arm, and then of course the hand. The upper arm and the antecubital fossa is going to be a whole lot less painful than the hand. Remember, the hand themselves are made for sensory purposes. We know that the palms of our hands and our fingertips are made to really be able to sense and interact with the environment. So, the hand in general is going to be more innervated more by nerves, which will cause it to be more painful. How rapidly will the solution be infused? This is important not only for the type of infusion catheter to use, but also the size of an infusion catheter. The smaller the bore on a needle or an infusion catheter, the slower it's going to infuse. So if you know that you need to infuse something fairly rapidly, like in a trauma situation, you're going to want to use those bigger needles, such as an 18 or a 16 or even a 14 gauge needle, because you're going to want to have that needle wide open so that solution can be infused very rapidly. Are there obvious varicosities proximal to the vein? Again, we don't want to try to insert an IV catheter into a gnarly, twisty, turny vein. And is the solution to be infused at increased risk of causing infiltration or extravasation? This is important when you're thinking about things such as chemotherapeutic agents in particular. And some IV antibiotics as well, antivirals. So if you have an infiltration, Basically, the solution leaks into the tissue or the skin surrounding the IV insertion site. Okay, so it's a localized incident that can be managed. But if you have a medication that is caustic to the tissue, that's a whole other story. It's one thing if you have normal saline infusion and that infiltrates. You're going to get a puffy area. It's going to be warm. It's going to be painful. But when you have a caustic agent that truly does damage tissue, you're going to be at risk for tissue death in that area as well. So that's basically what extravasation is when you have that caustic substance that leaks or seeps into the surrounding tissue at the IV site and causes damage. So with an infiltration, again, there's typically not a whole lot of tissue damage, but with extravasation there is. So those are very important to consider, because if you're going to be infusing a solution that is possibly going to put the patient at risk for extravasation, you want to make sure that you have a good, solid, inserted, large bore needle, so that you minimize those risks. And then again, we talked a little bit about the gauge of the needle that will be required for the infusion. That really depends on the location, the patient's venous anatomy. Do they have very small veins that are not going to tolerate a larger needle? And of course, the rapidity of the solution to be infused. So with all that being said, there's a lot that goes into even just the process of choosing what type of IV you want to insert, what type of cannula, what size. So all those things need to be taken into consideration.